Good evening, everyone. Thank you so much for joining us tonight, and thank you for your patience. We apologize as things are want to do on the internet. We had a little bit of some technical difficulties this evening getting some things set up with our cameras, so we apologize for that. But we are all good to go now. So in the meantime, I will get right into reading off that brief disclaimer that you see on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the prescriber. And so with that all being said, now I can say thank you so much for hanging on with us tonight. We apologize, and hopefully things will go without a hitch for the rest of the night. So my name is Craig Orpello, and I will be your host tonight. And you are here at the PharmAssist Virtual Learning Experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your own home. The PharmAssist program takes place every Monday at 7 p.m. Normally, except for tonight when it starts at 7:20 p.m. But we have a number of different live medications that we will be showing tonight. And our normal process is that we will walk you through 3 common fertility products, including an interactive Q&A throughout the program. And that is where you come in. By joining us via Zoom or Facebook Live, we invite you to be a part of the discussion by sharing your questions in either the chat or directly into the Q&A. And you can ask your questions and we will get to them throughout the course of the program. So tonight we will be discussing Avidril, progesterone in oil, and Cinera. And as always, we are joined by various amazing HCPs each week from across the nation to provide you with this real-world experience, just as if you were sitting across the table from them in their clinic. And so today we are joined by our very special guest, Wanda Hofgesang. So thank you so much, Wanda, and I will turn it over to you. Take it away, Wanda.
Hi, Craig, and hi, everyone. So happy to be here. Sorry, like Craig said, for our delay, just a little bit of the technical difficulties of getting everything off and running. It's so great to be here. My name, as Craig stated, is Wanda Hofgesang. I am a nurse who works in a fertility clinic at the moment. I work in the northern New Jersey area. I have been a nurse for many years, over 20 years, 25 years maybe, I think, but in fertility for almost as much time as well. And so as far as the teaching component with the virtual learning experience, it's so great to be a part of this program that Mandel's has, where we have the opportunity as nurses to come aboard and collaborate with a pharmacy and take a moment to do a live Q&A with question and answer session from you, the patient, who might be, getting ready to get started with your cycle. And you might think, what do I do? How do I work with that medication? So this video learning experience is a wonderful opportunity for that. And as Craig stated, we are here live, but these videos are also archived on the mymandelsPharmacy.com website. And so what I would encourage you to know is don't feel like you have to memorize everything very quickly and only the video. You will be able to go back on through the website and find all the medications, including tonight's or any maybe other medications that may be a part of your fertility cycle. You can go on and watch those videos as well. So it's nice to know that they're there. I think that's just a big thing to know, that even if something's not on here tonight live, it is there for you to be able to take a look at another point in time. One of the things that I always like to tell patients is that sometimes it can be very difficult when you see all of the medications at one time that you receive from the pharmacy. It could feel a little overwhelming. So I think it's real important to maybe look to organizing some of that. So just so when you do receive that prescription from your pharmacy, know that it's a real good idea to open up your box of medications and just kind of put like items together. You may not know what those items are for at the moment until you get started, but this way here you can have some sense of organization with, there might be multiple items, but then within those different items, you might have several of one type of medication, which is helpful to put them all together. And then you'll see that we walk you through the sequential order of these medications. It's never that you're all you're on all the medications at one time. So I think that's really very important to know, is that you would never have to take everything all at once. So our role tonight is to help you guys become pros in your injection technique and help you feel empowered to getting started when you get started with your fertility cycle. One of the things that I would also say is that if you have questions that are more specific to your treatment, we are always going to remind you to go to your healthcare provider, your fertility clinic, physician, and nurse team. It's real important for you to know that we're here to be able to let you ask, and we answer any general questions with your medications, but anything specific that we feel it might be best to be handled by your team at your fertility clinic, we're going to certainly guide you in that direction, but we'll also answer anything that we can as well. So one of the first medications, as Craig stated, that we will be seeing tonight is going to be Ovidrel. And so this medication, you'll see it's going to look like this when you get it from the pharmacy. And we will watch that video, take a look at how that video is used, how it is packaged, how to inject and prepare for that injection, and a bit of the injection technique with that as well. And then we'll come on back here for you to be able to ask any questions that you might have if that's a medication that you may be taking within your cycle. So Craig, you can let that video roll for us. The first medication that we're going to review for your fertility cycle is Ovidrel. Ovidrel is a medication that is used for ovulation. It either prepares you for possibly an egg retrieval, or it prepares you for an intrauterine insemination. And it just depends on which center and clinic you're working with as to which medication they use to help with that ovulation. But Ovidrel, just first off, just so you know what you're going to need, my biggest thing with Ovidrel or any of the medications in teaching is just to tell you what supplies you need before you get started. So just a little sheet here is letting you know that the supplies you need for Ovidrel is one pre-filled syringe of Ovidrel. It's nice and simple. That's only one item that you need. So to start out with this medication for ovulation is really easy for patients typically to use, and hopefully it'll be easy for you too. The nurse and me, the other part of this is very important that you know that doing a medication is not a sterile technique, but it is a clean technique. So once you get your box of Ovidrel and you're preparing yourself to prepare for the injection, what I want you to know is just go and wash your hands first, or if you have a little bit of bacteriostatic hand sanitizer, what I want you to know is just either way, it's just good to start off with clean hands, okay? This medication, like I said, is for ovulation, but the other thing that I want you to know about it is that it is a subcutaneous injection, which means it just goes into the fatty tissue, which is good because that's a small needle, and usually those are easier to sometimes tolerate for patients because they're a little bit easier to administer, and literally the pinch you feel is like a mosquito bite. So to give you something that you've already done, possibly to make this seem not so daunting, is if you've had blood drawn, you have done something more evasive than this injection. Little injections are a little pinch. That's literally all they are in the skin. So first off, when you open up your box of Ovidrel, what you're going to find in there is your syringe is going to be pre-filled, pre-dosed, ready to go. So as far as for patients go, this is one of the easier type of medications we could have you take for your fertility cycle because all you're doing is injecting. And we would always guide you at the center, your center, wherever you may be, with when you need to take it and what time, if there's any sort of time requirement for you with your center. So let me just open that. There we go. In the box is a syringe. You'll see it's pre-filled with liquid. That liquid is ready to inject. That's the medication. So simply, sometimes what you might see that people hear about is bubbles, and if you're worrying about any bubbles, you just give a little snap to the syringe and the air bubble rises to the top. I kind of I sometimes discourage sort of shooting liquid out because that is precious medicine to your cycle, so I don't want you to lose anything. So it's okay if you do a little bit of push with the syringe, but just be very, very careful if you do that. So I'm not going to uncap it yet because I want to show you where this injection goes. And with the help of my injection mannequin, what I want to show you is for this injection, typically you're going to use the lower abdomen, lower belly below the belly button. And when you take this, this is a one-time shot, so it can go anywhere in this belly. The other area to use are your upper thighs or outer thighs, because again, this is a fatty shot, so it just needs to get into that subcutaneous tissue. This injection can either be self-injected or you could have somebody give it to you. So what I'm going to do here is actually, if I were self-injecting and I was standing, and this is my body as the mannequin would be here, I just want you to see that the needle would go in at a 90-degree angle. The other part of this type of shot is that you pinch the skin just a little bit when you administer it, because you want to make sure that you're getting into the fatty tissue. So first thing we do to that area is we clean it with alcohol. Just get a good little clean there. Next step we do is we can uncap the needle. Just be careful. Put that cap down. And here's where I said that if you did a gentle little push-up with the liquid, if it comes out, you can do that, but you want to gently push that up and create a little bubble, and that bubble, or a little release of liquid, and that's fine. And then what we're going to do is we would pinch the skin in this belly, and we don't have to jab. Place the needle gently to the skin, insert the needle all the way, let go of the fatty pinch, push the medicine all the way in, count to 1, 2, 3, and then release and take out that syringe. And you can put a little cotton ball there. You might get a little bit of the fluid from the medication, or possibly a little bit of bleeding that you could have as well, but that's fine. That's what you should notice. The bleeding would go away pretty quickly. So with this medication, what you want to know about the injection is it's very quick. It goes in quickly. It's a little pinch when it goes in. And Ovidrel doesn't typically sting. Some medications can, and we'll talk about that if we have any. But just for this medication particularly, it's not usual that you'll find that it stings. Hopefully this has helped you to see how to work with your Ovidrel medication, and I wish you the best of luck with your cycle.
So that video was hopefully one that helps you to see the workings of the Ovidrel injection. And like I mentioned, Ovidrel is something that can be used for either an IVF cycle or an intrauterine insemination cycle. And it is the main product that is sometimes helping the body to finish its final maturation and prepare for ovulation. So that's really the reason you're on that medication. But it is one of the more simplified medications to use when something's already been mixed for you, it's prepared, ready to go. And the injection technique for this one is also one that's using a smaller, tinier needle. So that's also something that's a little easier sometimes for patients than maybe something that might be an intramuscular shot. Not that that's difficult, but with training, but it's just, this is certainly an easier medication with that technique as well. Right. I don't know, Craig, if we have any questions that are out there from anybody.
Yes, we do. How's it going? All right. So we
Going
have some
good.
questions coming in already. And just a reminder to everybody out there, you can, if you're joining us via Facebook, you can type directly into the chat and we will get all of your questions. If you're joining us via Zoom, you can put them into either the chat or the Q&A. Either way, we'll make sure that we get those questions for you. Just like this first one that comes in that says, how does Ovidrel differ from other types of HCG on the market? Are any of them better than the others? Anything I should know before I get started?
Other ways of HCG or ovulatory hormone could be coming to you as potentially intramuscular injections. So the technique could be different of where the medication goes. As you saw, Ovidrel is a tiny needle, so it's going into the fatty tissue. Other types of HCG might come where they are not pre-filled syringes and you might have to do some mixing. But really, it's just the presentation that is different. What that type of HCG Ovidrel is doing is it has the same impact. It's preparing for that final maturation step of those eggs and preparing for ovulation with timing of an intrauterine insemination or timing of that ovulation with a IVF, say, egg retrieval. So really, it's more the presentation that there might be variations, but the role of what that product is doing with the body is similar no matter how the presentation is.
And there isn't one that's better than the other, I guess is what I would say to that too.
Perfect. Thank you so much. That's a great answer. And actually, this question came in the middle of while you were answering that, so it's probably a piggyback off some of the things you were talking about. And this question comes up quite often. People, have specific questions about the product, like, how this injection is done or things like that. And then other times you just want to have the big picture of like, why am I on this? And so this question comes in saying, what exactly does the Avidrel and HCG in general do as part of a natural cycle? So maybe you could share a little bit more about just what Avidrel is replacing in the natural cycle for some people out there who really want to know why all these, like you said, there's a lot of different medications, and sometimes some people don't care and they don't want to know anything. They're just like, I'll inject it when you tell me to inject it, and as long as I get what I want out of it, that's great. Other people want to know what everything is, so this is a perfect opportunity to share some of that.
So in our natural cycles, what we have is a hormone that's called luteinizing hormone. And that's a hormone that typically when it's released, that'll be what forces that egg to mature and to release and prepare for fertilization. So when you take HCG or Avidrel, they are a technique, or I should say a medication that is human chorionic gonadotropin, maybe a recombinant variety of human chorionic gonadotropin. They replicate what the luteinizing hormone would do naturally in our bodies prior to preparing for, just say if you were having intercourse, as far as the cycle goes naturally, that's the hormone that's responsible for releasing the egg. So in the case of timed cycles, such as an intrauterine insemination or an IVF cycle for egg retrieval, that HCG Avidrel is mimicking the natural luteinizing hormone and helping to have the egg fertilized. That's the key. That's the key, is getting that egg ready for fertilization.
Thank you very much. That's I think can be a little bit of a complex conversation for people to understand how all these different medications work. And you did a great job making it very easy. And that's what we're trying to do as part of the PharmAssist program, is to make you feel comfortable, allow you to ask these questions now so you can get it out of the way before that moment of injecting yourself, but also really to make sure that you understand everything and everything that you need to know, all the questions that maybe you didn't get a chance to ask, or you forgot about, you didn't think about before. You can come to the PharmAssist program and ask. So thank you so much for that, Wanda. Appreciate it. Let's see, next question coming in. Okay. So this comes up almost every single time because of the specificity of the timing of this medication. Yep. And so there's always questions around, how specific do we mean when we say, take it when I tell you? And this one says, how exact does the shot timing need to be, / how tight is the injection timing window? Do I have to start everything all over again if I miss it?
Good question. And I do think there's a lot around this medication, particularly that makes everyone feel a little bit anxious because of it being the big ending, or I should say the big lead up to sometimes that egg retrieval or that intrauterine insemination. So your clinic typically will guide you with timing of all medications. I can say just within our own clinic that an intrauterine insemination, when you might be taking a ovulatory drug for that, there may be more of a time frame. The timing of the injection may not be quite as specific, because you just want to start the process of ovulation. And then typically the clinic will time the insemination procedures with that. So what I would always suggest is if that you're ever missing any timing of any injection and you are concerned, at all centers, even like our own, we always have sometimes an after-hour number to call so that you can be, someone can walk you through and be aware of what might be happening on your end when you're at home taking that injection. So don't ever hesitate to contact your clinic, even if it is in the evening, because oftentimes those are very important calls that your clinic would want to have be received by the clinic. So, that we usually will walk you through timing. And if anything's very specific, as long as you let us know, there are times that we are able to work with any issue and just make adjustments as needed on our end. So don't ever hesitate to just talk it through and call us.
Yes, perfect. And just like this program tonight, things happen and things may not go exactly according to your plan, but to Wanda's point, everybody is always ready and willing to help you through it. And you're not the first person this has happened to, just like we are not the first person this has happened to tonight. So you will always have a friend at the pharmacy, at the clinic, that you can reach out to and really work through these types of questions that you have. And that's really the point of the PharmAssist program, is to try to prepare you for that stuff now. So if something does happen later, you have a plan in your back pocket, similar to my new plan of having elevator music queued up next time if this ever happens again. Wanda, I was mentioning that while you were gone. I wanted to play some relaxing music for people as I was trying to get everything working on the back, but we're good. One quick question I do just want to throw out there that just came in, and this is something that I can actually help with, and Wanda, you can share as well, as one of our special guests who come on and help us with the PharmAssist program on a regular weekly basis. The question came in that says, asked if we do different medications each week. And actually, yes, we do. We actually list out what 3 products will be discussed in each week. So you have that as you can very quickly see what today's products are going to be and what was on past products as well, or past programs as well. And one of the things, when you go to the PharmAssist webpage, you will get a chance to actually, you can scroll through and just look for individual products. So you can watch this whole video from beginning to end. But you can also, let's say you're just looking for, the Avidril or whatever, you can click directly on that product and it'll show you all of the past times that we have talked about that product. And so, yes, so hopefully that helps out for anyone who was wondering if we do products. We do, and there are new products coming. We're constantly adding new things to the program. So I just wanted to answer that. So we didn't, normally we talk about that at the end, but I didn't want to leave that question hanging too long. So
yeah, in case we go dark again.
In case we never get to the end, right? You might as well. We got to answer questions while we can. You never know.
And it is a very, what I would add to what you just said though about going on to the videos, is it is a very user-friendly website with regards to that. So I would just want to encourage everybody, sometimes I think, some things are easier than others to go through, but when, I've ever sent a patient to view the video library, they always say it's pretty, very, very succinct and able to find what they need. So I think that's important. I would want you to know that it is very, very user-friendly.
Perfect. Sounds good. Well, thank you so much. I think we are ready, and we've answered most of the questions that came in there. So one thing I always want to remind people, we will give another 30 seconds or so right now if you're trying to get that last question in before we move on to the second product tonight. As always, it's not like you lost your chance to ask questions once we move on. We will get to any and all questions. So feel free, if you have a question that you think of later, or a question that's kind of a more general question that kind of ties maybe multiple products together, or just about your cycle in general, you can ask any of those questions. We will get to those and we'll answer all of them tonight. So no problem. But let's give just another 30 seconds or so, Wanda. So I'll throw it back to you if there's anything else you wanted to share before we get ready to move on, unless other questions come in.
Okie dokie. So the Avidril, as you saw, there are 2 main type of injections, and the next medication is going to be different type of injection technique. So the Avidril injection is that subcutaneous, meaning that it's going into the fatty tissue for absorption. And that's just how that medication is packaged and how it works for doing the job that it needs to do within your body. So that's just important just to know. And also what you'll see that we're going to do, the next medication is kind of nice to see the opposite of that subcutaneous, which is a intramuscular injection. So the next medication that we will be doing is going to be progesterone in oil. And progesterone might have a box to it. It may not. It may actually just come to you also then in a vial labeled progesterone. And what you'll find is this medication is in a multi-dose vial typically. So you have more than one injection in that vial, and you'll draw up a dosage that will be required for your clinic. And so the one vial may last you for several injections, and you may receive more than one vial from the pharmacy. And just know that your nurses are ordering what they hope to have you need for your entire cycle. And then if you ever need refills as we go along, then the nurses are always going to let you know that you have refills within that cycle as well. I mean, within that prescription. So it might be just important to note that that's what we call a multi-dose vial, which is something that you are using more than once. Just important. That helps a little bit. So what we'll do is I will let Craig roll that video, and we'll be back here for you to help you answer any questions that you might have with regards to an intramuscular injection of progesterone in oil. This medication video is to show you how to properly mix and draw up and inject a progesterone injection. With progesterone, why am I taking that? Probably is the biggest thing that we get asked first in the fertility clinics. And with progesterone, what you want to know is that's a key medication to helping the lining of the uterus be well supported and nourished while an embryo is looking to attach an implant for successful implantation. So medications that help that, progesterone being one of them, is used in your fertility cycle, and it's used to help in and around that embryo transfer so that your body has everything it needs in hopeful implantation for successful pregnancy. So that's the first thing you want to know about progesterone. The other thing to know is progesterone is administered into the buttock muscle. The reason sometimes with this medication that we often have patients ask about other areas, though, I was going to say, is that, you know, we use the buttock muscle because it's a big non-weight bearing muscle. I think I do get asked a lot, can I use my quadriceps? Your quadriceps, and I'm standing here marching in place, if I had to lift up legs that were getting progesterone shots, it might be a little difficult to do that. So the idea is that you want it in a nice muscle that's great for absorption, but doesn't have weight bearing on it. And that's what those quadricep muscles have, is that they have to lift the leg. The other thing is the deltoid muscles, where we might get flu shots. Not a great muscle to use for a progesterone shot, simply because it's just too much for these little muscles to handle. And again, these hands and arms have to be raised up, and then you're using that muscle to do that, lifting, grabbing something, and it would just be way too much. So just to confirm that the location is always going to be the gluteal muscle. And the nurses at most of the clinics, even like ours, we definitely, what we do is we try to do our best to help give you a circle on both sides of the buttock, the left and right. Because the thing to know about progesterone is usually you are on it for several days, sometimes it even can be a couple weeks. And the reason for that is in early pregnancy, it's what's helping keep that lining well supported, again, where that pregnancy is growing until we have a placenta that takes over, which is the mom-baby connection. So that's its key importance, and why you might be on it a little longer than some of the other ones is because that little phase takes a little while for that placenta to fully function. So the progesterone in oil is an injection that it's intramuscular in the buttock. It is used to help support the lining for hopeful pregnancy and nourish and give everything that that embryo could need to have a successful implantation. And it is also something that typically we would recommend that you have somebody administer to you. I'm not going to say I haven't ever helped somebody who had to do their own injection, but when it comes to muscle shots, if you have somebody that can inject and give you the shot, it just takes a little bit of that pressure off. The one thing I will mention is sometimes patients want little hints or help with this shot because they might have heard things about it. First thing I would say, as far as storage goes, it's really important that your vials of progesterone do not get refrigerated. So one of the things I will mention about that is when you get that nice big box from your pharmacy, possibly Mandel's, don't be afraid of it. Okay, guys, you have to open that box because human hands packed it. So you want to take that packing slip out and you want to just look to see quantity of what they've sent. That's really what a packing slip is, just like if we ordered something from Amazon. So what you want to know is it's really a good idea to open up that box, take a peek at it, see that you've got everything that it says has been sent to you, and hold off. You don't have to look through everything right away. But one of the things that I would say, particularly with progesterone, is that typically it's in an oil base. So oftentimes it's very important that it just maintains at a room temperature. So feel free to contact us if you have any other further questions, and contact your pharmacy ever when you do receive this medication. But definitely get it out of the box and leave it on that counter, or leave it in a safe shelf where nobody will get at it. One of the other things I'll just mention is
At our clinic, we're okay with letting you use the old tried and true, a little bit of ice to the area. And you're not over icing when you administer for this. You're just going to give a little ice to the area before the injection. And that helps just numb it so that you don't feel any pinch of the needle going in. So ice everybody has available to them at their home. So just know that that's one of the things that I will talk about again, but just to let you know that you can use prior to administering in that glute muscle is to apply a little bit of ice. And we'll also talk about another product that I'll be just showing you here, is just to let you know that there are Cinera patches, which are also helpful sometimes for people that sometimes have difficulty with getting blood drawn, and they've got a lot of anticipation based on that. It is a numbing type of cream patch that you put on to the area. So we'll talk about that later, but I just want to let you know there's some other options that you can talk to your clinic and to your nurse about in case you're having troubles with those injections. So with the progesterone, the next thing that we need to know are the supplies. And so once again, our little list here is for progesterone, we need 1 vial of progesterone in oil, and oftentimes it might come in a box that'll say right on there progesterone. You will need 1 3cc milliliter syringe, and there may be definitely a needle attached to that, so keep that handy. You'll need that 1 syringe, and that needle that's usually attached is this 122 gauge inch injection needle. That's usually what is already attached to that. If your syringe comes separately without a needle attached, you would need the 3cc 3 ml syringe, and separately a little package of a 22 gauge 1.5 inch or 1 inch needle. Most often, most of us need a 1.5 inch needle, but there are times that some patients are rather petite, and we can order a little bit smaller needle for them that'll still get into their muscle. But most of us technically need that 1.5 inch to get to muscle. And then 1 18 gauge pink needle. It's usually pink in color, a little pink on the label here. It might be hard to see that in color, but just to let you know, it's a pink needle. I want you to know that that is a big needle that looks like a nail. Never, ever, ever would we ever want you to have to do that as an injection needle. So just know if you see that when you open that box from your pharmacy, please do not panic. That pink needle is simply to help draw up the medication. And it makes it a lot easier when something's thicker in that vial, a little bit thicker oil substance, helping you draw it up from that vial is really easier with the pink needle, but then you discard that pink needle. Never, never, never do you need to have an injection with that. You just don't want to put that into the muscle, okay? So always, always, always ask if you're ever concerned and you just saw that needle and you forgot, what the heck is that for? And you're panicking that that has to be administered into your muscle. It does not. So it goes into the bottle only. So with all of our medications, as I mentioned, it is not a sterile technique to mix or administer medications, but it's always a clean one. So what you want to do is have nice clean hands after you get your supply, so you can clean with soap and water, or you can take a little bit of hand sanitizer and sanitize your hands before you are going to work with that medication and prepare it for injection. So with our bottle of progesterone, there'll be a plastic cap that we snap off. Okay, under there, what you want to know is it usually is sterile after you open it the first time, but this is what we call a multi-dose vial. You are going to use the contents of this vial potentially until it's empty. So because of that, each and every time you want to clean the top with a little alcohol. And if you get these little prep pads, you can use them. The other thing I would say to that is if you don't have prep pads, a regular bottle of alcohol, isopropyl alcohol with cotton balls will do. So you don't have to have these little prep pads. If you don't, it's okay. But most of the pharmacies, and I know the pharmacy Mandel's, they do supply this to their customers. So I just want you to know that they will probably be in there for you to utilize. Once you clean the top off, the next step is to take the needle and syringe that may be coming together, or if it's just a syringe, whichever, you need just the syringe to start. So what I always do is, this is in a little sterile package, and when you open it up, you can hold your hand on the needle, pull back the packaging, and just twist off the syringe. And you can leave that needle in there safely. That's our injection needle, so we'll leave it in there until we're ready for it. And then what we're going to do is we're going to take the pink needle, open it up from its package, And we're going to twist that gently on to the syringe. Don't over tighten, because remember, we're going to remove that needle, so we don't want to have it where we can't get it off. So you want to gently tighten it. And that big pink needle is what we're ready to go, and it draw up a dose of medication that we need to administer. Typically what I'll show you is a typical dose is 50 milligrams, which in terms of a liquid amount is a milliliter, 1 milliliter, or 1 cubic centimeter. So a cc and an ml is the same. That's the other thing, that a lot of us nurses have different lingo with that. So some nurses will say take 1 cc, and the patient may have been hearing from another nurse that said 1 ml. So a milliliter is equivalent to a cubic centimeter. So 1 cc is equivalent to 1 ml. Probably a good side note to know that, because we all do have our own little lingo, and I don't want that to throw you off. So I'm going to draw up some air. And the reason I always just do that is because there always can be a little pressure in the vial. So however much liquid you're going to take from that vial, you inject that much air. So you draw down and line up the rim of that plunger to that number 1. If you're doing a dosage of 1 ml, 1 cc, if you're doing anything more than that, your clinic is going to let you know that. So you'll always be following your directions of your clinic. And then what we do is we insert that needle straight into that vial. We push up on the bottle and inject a little bit of that air. And then we draw down and fill up to the 1 ml. With this one, you don't often find that you'll have bubbles, because it's not a water base. Being an oil base, there might be a little less bubbles in there. So sometimes you might hear about air and having to flick out any air. Not typical that you're going to have to do that with this medication. Okay, so you can remove the needle. The bottle, you will use it again until this bottle's empty. So remember, multi-dose bottle. Put it away. When you need it for the next injection, when you take it out, you clean the top off. You don't have to cover the top, but you're always going to clean with alcohol before you poke a needle through it. Okay, so multi-dose vials are good, because you don't have to use many different items and supplies. You want to then safely cap this needle. The pink needle is going to come off, and then I'm going to discard that in my sharps container. You'll have a red sharps container from your pharmacy typically, to keep safe all of your needle tips and all of your syringes. And then what we're going to do is take the injection needle and now twist that on gently to get ready to administer. So now we have our medication and our injection needle ready to go. A little hint, some people do, I've taught this many years, so it's no right or wrong, just some little tips you could do. If you'd like to, you can roll this syringe in your hand. Because it's an oil base, sometimes people hear that, what can I do to kind of help with that injection when it goes into the muscle? And what can I do to help it absorb or break down into the muscle? So because this is a little bit of a thicker solution, certainly that's the reason why it takes a little bit longer to have it break down. So one of the little tricks could be this rolling, because just the friction and the heat from your hand can do that. I know some clinics might even actually recommend that you could take your tap water, run warm tap water, and the needle's covered that's sterile, and you can run it over a little bit of warm tap water to just, once again, do what you can to sort of, to make it a little less thick when you go to give that injection. Okay, so those are just some little tips that you can try to see if they help you, and I hope that they can, with this injection, help you. The other thing that is a little tip that I know we do at our clinic is, I'll just get my mannequin. This is an injection that's going to go now into the muscle area. Pardon me, she's losing her undies or underwear. The side here is open to show that the red is the muscle. That's why we need a longer needle, because we need to get into that muscle. And all of us have a little pinching of fat. So the yellow is fatty tissue, the red is the muscle, and that's the sciatic nerve. But the nice thing is, when your clinics and the nurses there are marking you, which a lot of times all the clinics do that, they are marking the appropriate area that you're going to need in your gluteus muscle. So what you want to know is, we're marking what's called the upper outer quadrant of the buttocks to administer that shot. So you don't even have to worry about that sciatic nerve, because where we're usually marking you is going to be free and clear of any of that. Keep in mind that when you get this injection, the administration of the needle is something that we'll talk about. You might feel a little pinch if you don't ice the area, or if you don't use one of the Sanera patches, which helps to sort of numb it. If you don't do either of those, then you would feel a pinch with the needle. You might feel a little bit of pressure when the fluid goes in, but it's very fleeting because you're not putting in a lot of fluid or a lot of medication. Really, with muscle shots, it's the next day. And any of us that have had flu shots or anything, vaccines in our arms at times, you know that your arm feels a little heavy or a little just tired. Or when you work out at the gym and your glutes are a little sore, that's really what you should potentially feel after a muscle shot. There should never be redness, warm to touch, itching, swelling, severe pain. And if there is, always contact your center and speak to your center's, your nurse and or your team, because they would want to know about that. Because we don't want you to feel as though that is a normal symptom that we should feel after we administer these shots. A little soreness, and you should be able to rub at the glute with your hand, but anything more than that, definitely that's something that you can report to your nurse in your clinic. The other little thing that I'll mention about after the injection that's a good idea is gentle massage. Some people even use the foam rollers from their exercising to sort of roll over the area a little bit. If you have a handheld massager that's got some heat, that's great. A little bit of warm, moist heat. These are all things that are just comforting to the muscle, and it just helps. So what you'll find with this injection when we do have to administer is the nurses will hopefully have helped you with where to give it and have circled that area. And usually we put circles on both sides, and we do it in Sharpie pen, and you can retrace it because it'll fade a little bit in the shower, but it usually doesn't ever go fully away unless you really are rubbing at it to, you know, with soapy water and such. So it'll fade a little bit, but you can retrace. And you want to move the injection around each evening to a different side. You would want to alternate right, left, left, right, and within that circle, moving the injection around, just so that it gets to all of the muscle and it's not so difficult that it's having a difficult time breaking down, okay? With this medication, as I mentioned, it is intramuscular in this glute, so it is recommended if somebody could administer the shot to you. If you want to, you could stand for the injection. If you stand for the injection, if somebody was administering into my right glute, what I would do is I would stand and put all my weight on the left side, and I would just lightly touch down my right leg. What I'm trying to accomplish with that, if I stand, is I want a relaxed muscle. So that's one way you can do it if you'd like to stand. If you don't want to stand, then what you could do, if I were administering and this was a real person here that I would be administrating, her front of her body would be facing you, and the back here where I need to administer is facing me, and I would administer. She's laying down, so her muscle is already relaxed. So key thing with progesterone shot is a nice relaxed muscle, so that just it's nice and easy going in. And again, if you're using a Sanera patch or a little ice, if you do any icing, we always do recommend, though, do not over ice. There's no reason for that. You could just do a couple minutes on your timer on your phone, and that'll numb the surface so that you don't feel the pinch. A little bit of the soreness that you feel, what helps with that really is warm, moist heat, gentle massage, even, like I said, walking around, activating that muscle, but you'll feel it a little bit, but it's not excruciating, and it should never be that you can't sit, walk, sleep, etc. It should never interfere with daily activity. That's important. And if it is, then please notify your clinic's nurse team, okay? So if I'm ready to do my progesterone shot and I have the area and I've iced it already and I'm giving this to someone, I'm going to take my cotton ball with alcohol and I'm going to clean that whole little area. My next step is going to be to uncap my needle. I know this looks a little scary. What I want to say to you is literally the little tip is what's sharp. We don't really, when we're given a shot, we don't sense how deep it is. We sense when it went in. So if that helps you to kind of understand that, I understand completely by looking at the size of the needle, but I want to help to relay that it's the tip when it goes in will feel like a pinch, like when you get your blood drawn, okay? With this one, we do not need to pinch and gather the skin. We actually are going to keep our hands away from that area so we don't get hit, but you could open up, do a little L with your hand and wrap it around. Remember, I would be behind this person if they were standing, and if she's laying down, I would have her on her side and I could be sitting. But in this little video here, I kind of have the angle of this needle going in at roughly a 45-degree angle. The needle going into the body in my hand is in a 45-degree angle. It is not pointed the needle down to the floor, and it's not parallel to the floor. It's roughly 45-degree. No jabbing. That's not necessary to trauma the skin. Place the needle to the skin and give it a little gentle push. The needle goes all the way in, because that's a question I always get asked, and it needs to go in to get into the muscle. What you then do is take your hand that was wrapped around the hip and hold that needle in place, and you're going to pull back gently on the plunger. When you pull back gently, what you're looking to not see is any blood enter the syringe. And I want to let you know that it's very rare to happen. I think in my 26 nursing year career, I've maybe hit once or twice where I gave a shot and it even hit a vessel or a little vein. It's okay. If it does go in and you notice it and the blood enters here, not a problem. You haven't injected anything yet. However, what you want to do is remove the needle. What we have you do is remove the needle completely, change the needle tip. You can use the medication because it's going into the same person, and go to the other side and reattempt to administer. It'd be highly unlikely to have that happen a second time, okay, just to reassure you of that. But if you pull back and you do see blood, just stop, think of a stop sign, remove the needle completely. You'd put a little cotton ball there, put a little Band-Aid if you need to, and then go to the other side, but change the needle tip, because the needle only goes into the body once and comes out once. It doesn't go back and forth and in several times. So when you pull back, what you're mostly going to see is nothing. There's no change in the color of this liquid, because oftentimes you're in that good spot that's been marked for you. And then you just gently push, and it's going to take a few seconds with the progesterone because it's a little bit thicker, but you push it all the way in. You can do a little 1, 2, 3. And then you remove the needle in the same angle as you inserted it, gently from the skin. You remove it, set it down. Don't panic if you see a little oil coming out or a little blood. Put pressure and hold that cotton ball there for 10 seconds. Here's where some people like to put Band-Aids on, some other people don't. All I will say about Band-Aids is don't leave them on in the morning all day until you do your next shot the next day or anything like that, because you will get rashes from some of those Band-Aids even if you don't have a latex allergy. So put the Band-Aid on if you're getting dressed and you just don't want to soil your clothing, but at some point take it off, kind of like we do with our arm. We don't walk around with that, you know, gauze and Band-Aid there. It's just there to pressure to help that bleeding stop, but this is not even going in a vein. This is going in muscle, so it'll stop pretty quickly, okay? And then remember, with progesterone, that you can find out from your clinic what they would like you to do, if they would like to add in a Sonera patch that we'll be talking about at some point on the videos here, or just want you to use a little bit of ice. But post-injection, the key to that is just a little moist heat, a little warmth, a little gentle massage. But the ice really can help with the pinch. And the nurses marking the area, I think, gives you a lot more confidence in knowing where it is that you need to go. Okay, so remember this. This is a shot that when you're taking this for several weeks, you have a nice pregnancy. So the whole goal of your fertility cycle is now manifesting, and when you're doing those injections, a lot of people don't want to get off the shots because they're concerned about doing that for their pregnancy, but you don't have to worry. When you come off those shots, it's a nice reprieve, but you've been doing them and you have a good reason to be doing them. So best of luck with you. I hope these tips help you with the mixing and the administration of progesterone.
That's a good video to see that I think contrasts the Ovidrel injection. It's nice to kind of have two back-to-back videos, I think, that show two different techniques, since those are the two primary techniques for your injection for fertility. It'll often be either a subcutaneous injection or an intramuscular injection. And progesterone is kind of one of the bigger intramuscular shots that I know a lot of patients are anticipating at times that come up. But I would say that the clinics are very good at guiding you with all of that technique that you might need for that medication, just so that you know, because we realize that that's a big one, and oftentimes patients have a lot of questions. So I'll just go right to it, see if Craig has any questions that are out there, and we can try to answer them to the best of our ability for you.
Sounds good. All right. Yes, we do have some questions coming in for progesterone and oil. First one is, what is the difference between progesterone and oil and capsules or other presentations? Why does progesterone need to be injected with oil?
So there are different forms of progesterone, and a lot of clinics like ours as well use different forms of progesterone for different types of cycles. Some of it might just be for absorption issues, depending upon the dosage that you might need. Sometimes it's might be more advantageous to take something that might be an injection, because then it's not giving so much of a systemic symptom. So there are oral capsules that sometimes can, they're fine, they're good, and we use them for cycles as well. But sometimes some patients might have some sort of sensitivity to, if the dosage is of a dosage that might require a little higher dosage, it might be beneficial to use something like a vaginal suppository or like an intramuscular shot that won't give you as much systemic feelings or symptoms, shall I say. So progesterone is one of those things that it comes in different varieties, and depending upon the type of cycle, this is where it's nice to have the opportunity as a clinic to not have to just do one type of progesterone. But there are reasons why we might do certain progesterones within particular cycles, based on absorption, based on the type of dosage, et cetera. So those are important key things to know, that's why we have a multitude of different variations of the same medication. When it comes to it being an oil for the injectable, that just is helping with the absorption. It's going into a muscle. So certainly for absorption reasons, that's a compounded medication often. So it's something that might work better in an oil in order for the absorption to be there when it comes to an intramuscular shot.
Perfect. Thank you so much for explaining that. I think that that question comes up quite a bit, and people are a little confused sometimes, because they feel like, well, if I can just take the capsule, I'd rather, why do I have to? It's like, well, it's not that easy.
Exactly.
It'd be great if it was, but it's good to also understand why the different presentations are available and why they're necessary, and why you'd be on one versus the other. So great question and great answer. Thank you so much, Wanda.
You're welcome.
All right, let's see. So we know that sometimes this is one that people get a little bit nervous about, just because it is different in the way that it's given and where it's given and all of that. And so this question is not a surprising one. This comes up quite often, and it's more, we want to just help people get comfortable beforehand, so that they, you approach. This is one of the shots more than anyone that we want you to approach feeling like you've gotten all of your questions, concerns, all of that out beforehand, so that you're not worried about this one. And so this question is a perfect one to help with that. And it is, can I do damage if I or my husband inject it into the wrong spot? Can I hurt myself if I inject it directly into a nerve?
What you'll find with this medication, as I said, a lot of times at the clinics, we are trying to do our best to mark the area of where that injection is given. Because I think sometimes the biggest misconception, I would say, is that a patient feels that it has to go into a very specific spot. That is one of the reasons and the advantages of using a big muscle like the gluteus or the buttock muscle, is because it's a bigger muscle. As you heard me say in the video, like this area here in our arms are a smaller muscle. So yes, getting our vaccines, such as a COVID vaccine, this is an appropriate area because it's a smaller muscle. But even within that smaller muscle, there's an area that can be injected. So same with the buttock muscle, it's a big area. So we try to really narrow down, just pinpoint the area. If you were to inject in a nerve, it could make it irritated, really. You might feel some irritation. Even if some people have asked me, if I were to mistakenly inject in a vein, sometimes you just might get a little bruising into the area, more than just a normal, some people just sort of have a bruising tendency with injections or when they get blood drawn.
But sometimes if you've gone into a little vessel and you know, you didn't check ahead of time, the worst of it might be that it would be a little bit black and blued in that area, which we would advise you to stay away from. So it will generally heal. It'll be something that's usually going to heal on its own. It's just that the nerve could get irritated from the medication, but typically it will be something where you're guided away from that nerve. I really want people to know that we're really guiding you with the spots of where that injection's to go away from that nerve. So that nerve is a little further inward than where these injection shots are going.
Thank you. That's, I think that's very reassuring. And that's one of the things part of this program is to help reassure, to make sure that you feel comfortable now. Getting that part out of the way, I think people feel like it's like playing, you know, like playing darts from 150 miles away. And it's not that pinpoint where you're like, you know, where you have to worry about it that much. Well, there we go. You okay?
Yep, I'm there.
Sorry. Just making sure.
You know what it is? There's actually a full moon because I'm looking out my window to the east and I'm like,
It has to be. It makes sense now. Now it makes sense.
It's an April pink super moon. So that's what's going on here.
Sorry, everybody. You have joined us with a April pink supermoon, and this is the outcome of that. This is how it's going to play out tonight.
You know, the world is turning.
It's great. We're doing great. Everything's pulling together. This actually, well, it brings me to, there's another question there's a couple of questions that are actually kind of tied together. So I'm going to present them to you, Wanda, a little bit in tandem, and you can kind of answer both together. And the questions are about the way that we give this shot, because it is so different than some of the other shots, and you know, people do get a little bit nervous about that. So we want to make sure that we're helping people kind of understand the different ways, whether it's yourself giving it or a partner or anything like that. And so the two questions that come in are, on one hand, somebody asks, is it better or does it matter at all to inject myself or to have my partner do it for me? That was one question that came in. And then another question that came in that part of this relates to that, and so you can help with that part. It says, is there a PIO video that shows the individual doing it themselves? As a potential single mother by choice, I don't have someone here to give it, and I know my clinic said that I can do it. I was just wondering if I could have a visual that exists. So kind of tie those two together. We can talk a little bit about the video part of it, you know, separately, but just, I guess, kind of, there's obviously a lot of people out there wondering, is this something that requires a partner to give it? Is there something that is better about that one versus the other? And I figured I'd kind of tie them together so you could answer those two together, and then we could touch on the video aspect of it afterwards.
So that's a really good combined question. And I would say this, that, you know, we really have to, at the clinics, try to provide the best instructions, and each patient has their own individual circumstances of what they can do. Meaning, if you are with a partner and they are comfortable injecting, then sometimes they will. But sometimes I've had patients say, listen, you know, my partner's really more afraid of needles than I am, and I feel like I'd rather self-inject. It would keep down my stress level. And then there are patients that are, as the person that sent in their great question, where they may not have a partner available to them in the evenings to give this injection. Sometimes I might suggest, if they think about somebody else to recruit, whether it be a girlfriend or a guy friend, it doesn't matter who that person might be. I've had in my clinic be family members. I have had people have friends that went through fertility. I have had mothers giving their daughters injections. So there's been a multitude of people that I know sometimes are helpful. So that's just something to consider. But if your fertility journey is one in which there aren't a lot of people that know what you're doing, understood. So I know I technically would recommend that if you're near your clinic and you're able to go in on one of your visits, to meet with one of the nurses to have them show you in person. Oftentimes what I suggest is to have the person that's self-administering, they can sit in a chair and they can have a mirror to the left or to the right. And depending upon, you know, doing this with the left and right sides, we will mark those circles, and they're just simply going to be turning to that left and right side to give the injection. And the mirror just helps sometimes because we're twisting, and it's just a little easier that you don't have to twist as far if you're using that mirror. So that might be one little tip that I know that's out there that we might suggest to you. So hopefully that can help, but I would certainly inquire at your clinic if they say it's okay
to maybe meet in person, to go over that with regards to the self-administering technique.
Yeah, definitely. And I know we do have one thing for people out there who are wondering, we have a number of different videos, a number of different nurses who have done these presentations talking about the PIO videos and how that works. And so we do have information that we allude to it a lot. I mean, obviously it's a little bit different because no matter what, when you're using like an injection block, or you're using an injection dummy in this case, that you can, it's hard to simulate it being yourself, just because it's not yourself. You're injecting into a,
Right.
into a third party object there. So we allude to it and we talk about it and we try to help and say, hey, here's how you would do it if you were doing it yourself, similar to exactly what Wanda just said. So one thing I would throw out there, just specific to the video side, is to go check out the PharmAssist webpage. There are a number of different videos that can help you through that, in addition to the one that we just showed you from Wanda. But that is a great idea to also reach out to your clinic and have them help you with that. And that is a note to self that I will definitely take, that maybe that's something that we could add to the repertoire of different videos that we have, is to try to show one that demonstrates that a little bit better, of at least shows, here's the angle that you would use, here's the way that you would do it, here's the hand that the hand motion you'd use to find the right spot, things like that we can definitely do. So great question. Thank you. There is plenty of information out there, and we would love to also provide more of that information for you. So thank you so much for that. And thank you, Wanda, also for helping with that, because I think probably one of the best ways is also to, if you can get into your clinic, they will have more than enough experience to be able to show you and to kind of walk you through that process. But if you can't get in, like I said, there's plenty of different videos out there, including the ones on our site, that can help you with that. So hopefully that helps. And a great question. And we really appreciate that. And we understand, sometimes there's different circumstances for different people based on what your fertility journey is. Not every journey is the same. And so you're going to have questions, or you're going to have needs that might be different than some of the things we touch on here. So we definitely appreciate that anytime you can bring that up, so we can make sure that we get those answers for you as well. So great. Thank you so much. And so, Wanda, with that being said, it looks like we have wrapped up questions for the PIO right now, the progesterone and oil. So we can get ready to begin moving into that third and final product for the evening.
Okay, doke. So I did mention this next product that you'll see is the way in which you can help yourself to not feel a pinch of a needle or a little stick of a needle. Fertility is a challenge because there are multiple medications. You're taking sometimes multiple injections daily, and we do understand that it's a very big challenge, as well as blood draws. Routine blood draws that are part of the monitoring process. And so it definitely is not that something that we want you to feel not supported in how do I handle that? How do I get over that? We would never want to have somebody have that be the obstacle as to why they might not move forward in their fertility cycle. So I know it would be really important for us to address. So the little tips I've spoken in the progesterone oil video, where you could do a little icing if you really, can't have a prescription, ordered for whatever your reason. That is certainly a little hint to do. But the nice thing about the Cinera patch is something that could be ordered with your fertility medications. And it'll look like this. It does come in a box, and there are 10 patches per box. And that should cover you for at least some injections that you're going to be doing. Because remember, the patch is going to be a little bit bigger, but the area that it might be numbing, if you had to do two even like little injections, you could put two little injections pretty close to one another. So one patch might even do the trick in that area, or the one intramuscular shot that you might be taking. So the Cinera patch is the video that we're going to roll on next, so that you can see that there is another medicated option out there that you can talk to your healthcare provider and your team about, and see if they would be able to order that for you with your fertility medication. So we'll take a look at the Cinera patch video and then come on back for any live questions.
Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you If you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn, and this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is to just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Cinera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use. So you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that might have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspect, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle.
That video is very helpful to see the Cinera patch. And as you can see, it's pretty simple to use, and it is very effective. And I think that it's really an important complementary part of, could be for some patients. Again, if some people don't need it, then they don't need it and they can use a little ice. But sometimes to know that there's something else that you have available to you, that can really help in the planning of obtaining your medications and help to free up any sense of worry or concern that you have over these medications, and specifically the injections themselves or the blood draws. So Craig, I don't know if we have any further questions on that, since it's pretty quick and easy, but I know that can always be good questions.
Yeah, now there are a couple of questions. First one coming in says, what happens if I leave the patch on for too long? Can it be dangerous? Can I get addicted? Is there anything I need to be worried about?
I mean, there's a reason they give you a time frame, just because they know that has the maximum effect, is the 20 to 30 minutes. So if it gets left on a little bit longer than 30 minutes, it's not not going to present itself as a real issue. But mainly what you want to remind yourself of is that it is a numbing agent. So it's numbing that area. So you just don't really, you want to be able to let that area then, once you're done with the injection, kind of come back to life, so to speak. So you're got to be careful of touching the area or scratching it, or temperature changes after you've had a patch on, because your body won't recognize that. So I always think of it like when we have Novocaine, when we get a some dental work done, sometimes we're told not to eat right away because you could bite down and you can't tell that you're biting down on your gum or your cheek. So doing it a little longer shouldn't be presenting you with a real issue, and there's not going to be really an addiction issue to it, hopefully. I mean, I think the idea is that we want you to feel that it worked and that you didn't feel the injection going in, et cetera. And that would be, the proof of the product, really. But you just don't have to use too much, because one is perfectly fine. And you certainly want to be able to maximize the supply that you have too. It's what I think is important.
Perfect. Thank you. And this question is kind of a piggyback off of what you were just talking about when you're talking about some of the Novocaine, like when you go to the dentist and so forth. And a lot of times people just want to know, so how long does it take for the effect of the patch to wear off? Specifically because of situations where obviously, yes, you don't want to have a part of your body that is numb and you lean up against something hot or cold or something like that. So people are just trying to get an idea of how long they should be prepared that might last.
The idea behind it is probably after you've put that on and you've kept it on for that 20 to 30 minutes, that really you should, within over that course of up to an hour, by then it should be that it's worn off. So, it does take up to 20 to 30 minutes to have the nice numbing effect. So like anything, then once you remove it, it's going to take a little time now to back it down a little bit. So should be really no more than hopefully an hour that you would have that full, not as numb, and should feel like you have more sensation, basically about an hour.
Perfect. Thank you. And actually, you were right. This one is a little bit easier to understand and follow for most people. So it looks like as of right now, we are all wrapped up with questions. I will take a second to go jump back over and see if anything is coming in. But in the meantime, let's maybe give another 30 seconds or so if you have questions about anything, whether any of the 3 products we talked about tonight, combination, a generalized IVF question, anything like that. And I will turn it back over to you if there's anything that you wanted to share before we get ready to wrap up for tonight.
All righty. Well, thanks everybody for your patience. I know it's been a little bit longer tonight due to a little delayed start, and I really do think it has something to do with the beautiful full moon that's out there. So hopefully you can get a chance to go look at that. One of the things I always try to do at the end of my videos is just to give you something to be able to help you get through and feel like you are embarking on your journey with some empowerment. I am also a certified healing touch practitioner, which is dealing with energy medicine, your energy field of the body, the energy centers. So I brought this up before about daily affirmations, how simple statements, a daily affirmation is a simple statement that describes a goal in its already completed state. And you bring more energy to any thought or action, and you increase the power of that thought or action when you make a affirmation. So for fertility patients, I know, and where I get some of this information from, by the way, I've shared this book before, but Louise Hay, You Can Heal Your Life. She was for over 30 years, a personal growth and self-healing person who has a lot of books out there. You can find them on any of the internet sites for books and such. But what I was going to say is I find a lot that fertility patients feel like sometimes their body isn't working with them. They sort of feel like, why am I not able to conceive? Is there something wrong with me and my body? And I think that's an important affirmation that I want to share with you that will show. And the other thing is just being able to take a little pressure off yourself and not being so hard. You've made a decision to be at a clinic. You've worked really hard to get to this point of starting a cycle. And so we want to, at this video learning experience, be able to give you something to walk away with besides the instruction to say, hey, I feel good about myself getting through this, and I know I'm supported. So one of the affirmations that Louise Hay talks about is, I am at home in my body. I am at home in my body. That's just a really good, daily affirmation in the morning. I am at home in my body. And right before maybe you're getting started with the cycle, it might be good to say that even before an injection. And then I love and approve of myself. And we all can use this nowadays, is I love and approve of myself. These are just little tips, little tricks that you can add besides the actual, injection videos, but just some things that you can add to the injection video experience that can make you feel that you can get through the challenge. So I hope that helps. I hope you guys can take a peek. I know Craig puts a little snippet there to tell you where you can get that read or the author of that book, but feel free to take a look at that. And again, thank you very much for being a wonderful audience, for asking such great questions tonight, for being patient with us with a little bit of the live video foibles that can happen, as I should say. But we appreciate that. And remember that we are here live every Monday night at 7 p.m. For the live event with the live question and answer session as well. And also that archive of all the videos on mymandelsPharmacy.com PharmAssist, which is a very user-friendly for the patients. And it's not just me. There are other wonderful nurses that are part of this program that we all collaborate and bring to this program our experiences from our different clinics and through our years of experience. So it's just a great way to collaborate with Mandel's Pharmacy and with wonderful nurses and professionals that are out there with so much experience and knowledge.
Thank you so much, Wanda. First off, I just want to say thank you for all of your time and expertise, and for dealing with a lot of, like you said, some of the issues that we had tonight, which was crazy, but it was a nice test for us to see that we can handle this. The PharmAssist program can power through these types of issues and still get through all 3 products, which I count as a huge win for us. And by the way, I just wanted to share with you that I wanted to say thank you to Jordan, who sent out there and said, thank you, Wanda. I'll be checking out the other videos and I'll tune in next week as well. I have to jump off, but this was great and put my mind at ease. So that is exactly what this program is for. The whole hope behind this is to really put your mind at ease so you can ask the questions today so you can be an expert tomorrow. And hopefully we've helped you get there a little bit tonight. Thank you obviously to everyone, Jordan included, but everyone out there who joined us via Zoom, Facebook Live, for sharing all of your excellent questions. We hope you were able to learn something, that we brought something to the table for you. And we definitely got some great ideas from you as well tonight. So we appreciate that. We really want this to be an interactive program. And we mean that not just with your questions, but with your ideas and suggestions. So please feel free to share those with us via Facebook or directly at our webpage as well. And speaking of our webpage, don't forget that you can find all of these videos, both the full virtual learning experience videos, the VLEs, as well as the individual product demonstrations that we talked about for all the different products on demand on our YouTube page. You can find them on our Facebook page, and you can find them at mymandelsPharmacy.com/pharmacist. As Wanda just said, I always like to repeat it because just in case, you never know, sometimes the second time is the one that'll sink in and you'll remember it. So mymandelsPharmacy.com/pharmacist. There's plenty of other stuff there, not just these videos, but the PharmAssist program is expanding right now. So we have plenty of new things in there. We have our behind the shots, which is our stories where our nurses get to share their versions of why they got involved in fertility in the first place, why they're there today. So it's really good for support there as well. We have our Leaning on Sunshine page, which is a great page to really get some support and have a shoulder to lean on when you are going through this process, to see some pictures, some great little quotes, and things that can really help you when you're looking for that support, not just in a question, but sometimes in a, in a shoulder to lean on. That's what the Leaning on Sunshine page is for. So there's plenty of information there. We invite you to come check that out all the time. And we will be back again next Monday night at 7 p.m. Eastern. And you can check out not just all the different videos that we're going to talk about. We will let you know up front the different products that we're going to go through as well. So you can go and pick through and see what we're going to talk about, and then go check out those videos individually. The most important thing is, please, if you got anything out of this, if you thought it was good, whether you were here live or you checked it out on demand, if you thought it was valuable, please share it. Share, whether it's with a family member, a friend, a colleague, somebody who you know is going through a similar circumstance such as yourself. That's the best way for the story of PharmAssist to get out there, and really for us to help more people. So just ask that you share, whether it is follow us on Facebook, and then when you see that we're providing a live show, share that with your friends on Facebook. Anything like that is a great way to help out. And with all that being said, thank you again to everybody. Thank you so much, Wanda, for an amazing presentation. Thank
You're
you
welcome.
to all of you at home. Thank you to everyone back at Mandel's for helping to put together this program. And we look forward to seeing you here again next Monday night at 7 p.m. Have a great evening, and we'll see you here at the PharmAssist program next week. Bye,
Awesome.
everybody.
Thanks, Craig. Night,
Bye, Wanda.
everybody.